Hey, I'm Dr. Bryan DiMarco here at Renew Dental. We get a lot of questions about dental veneers, so I'm here today to answer a few of those questions and hopefully give you a better understanding of how dental veneers could work for you. So essentially, a dental veneer is a thin covering that will go over the front part of your tooth in order to improve the way that it looks and the way that it lines up in your mouth. What problems can be solved with dental veneers? So generally, when a patient comes to me and asks for veneers, what they are usually looking to solve is that they want to improve the look of their teeth. So with veneers, we generally can change the color of the tooth, the shape of the tooth. We sometimes can correct some mild crowding if you have some teeth that are overlapping slightly. The other thing that we can do with veneers is we can slightly change the position of the teeth so that your teeth are lining up better when you bite together and that you have a more natural looking smile. So patients will often ask, are veneers permanent or removable? So I generally don't like to use the term permanent because nothing is going to be permanent forever, but a veneer is considered a final treatment. What that generally means is a veneer is usually going to last about 10 to 15 years before you start to see some differences in the color, because usually the tooth underneath is getting darker, or you might have it chip or slightly break on you and then you need to get them replaced. So it is a longer term treatment option, but it's not something that's going to usually last for the rest of your life. Well, what should I expect during the process of getting my veneers done? So generally with veneers, depending on the type of veneers, we're generally looking at about 3 appointments. So the first appointment is that diagnosing and that planning appointment. We're going to be taking some records of your teeth so that we can send that to a lab and start planning your case out. The next appointment is going to be what we call the preparation appointment. So what that means is that we're going to start preparing your teeth so that they can actually have the veneers on them. We're also going to take a scan or impression of your teeth so that we can send that prepared tooth to the lab and get them to start making your veneers for you. And then the last thing we're going to do is we're going to put on a temporary veneer for you so that you go home with a temporary that's covering the tooth. Looks pretty close to kind of the final result, just isn't as strong as the material that they're going to be able to make in the lab. And then you go home with those temporary veneers. Then generally after about a week or two, once the lab has made the case, we'll get you back in. We're going to remove those temporary veneers, cement on your permanent ones, and then we're going to make some adjustments, make sure everything is lining up correctly, and then you're good to go with your new veneers. Will veneers match the color of my teeth? So this really depends on you as the patient yourself. If you like the color of your teeth, we can match it very similarly to the color of your teeth. Some patients though, and usually why they're getting veneers is they want to have a brighter, whiter smile. So in cases like that, we also can increase the whiteness of your smile so that your teeth are much brighter and have that higher or better look to them with the new veneers. So when it comes to veneers, there's generally 2 types of veneers. So we have porcelain and composite veneers. And patients often ask me, what is the benefits and the cons of each of these different options? So when it comes to composite veneers, what that means is that we're using a composite or kind of like a plasticky material, and we're making the veneer inside of your mouth. So the only benefit to this is that the cost of it is much cheaper because we're not really having to involve a lab and using those more high-end materials such as the porcelain. The downsides of it though is because it's done directly in your mouth. Generally, we can't get the same level of aesthetics or looks that we can get with the porcelain ones. The porcelain ones tend to look much better and more natural. The other thing is that the plastic material, it doesn't tend to last as long as the porcelain. So usually you're not going to get the same lifespan out of it. Also, that plastic material is going to start to pick up stains over time. And generally these have to be replaced about every 10 years at most, because they're starting to pick up stains and they're starting to not look very good. The other thing is that composite material isn't as strong as the porcelain material, so they are a bit more prone to chipping or breaking because of this. So when we look at the porcelain veneers, this is generally the gold standard or the best option we have available for the veneers. So because they're made in a laboratory and they're made with porcelain, they tend to be quite strong. And also because they're made outside of the mouth, the lab technician has a lot of flexibility in terms of how they make them look. So they generally can get them to look very good and very natural, and it gives us the highest level of aesthetics. The other thing is that porcelain is going to last a little bit longer. So with the veneers, generally we're looking at 10 to 15 years, hopefully a little bit longer, and that material will hopefully last longer than the composite. The downside of it is that it does cost a little bit more, but again, with you getting that longer result and usually that better result, patients find that they're much happier with the porcelain veneers. How long will it take to place veneers on my teeth? When it comes to this question, really it depends on how many teeth we're actually doing the veneers on. So if we're doing, a simple case where we're just doing maybe 6 front veneers or 8 front veneers, usually we're going to have a couple of appointments that are going to be maybe an hour and a half to 2 hours each. If we're doing more of an involved case, say someone really wants to increase the whiteness of their smile and we're doing the top and the bottom, then we might have a couple more appointments where it's going to take a little bit longer. Generally, that's what you're looking at for time. Do dental veneers require special care? So when it comes to veneers, just like any other treatment, we do want to make sure that we're taking care of them from a hygiene perspective. So we do want to make sure that we're brushing twice a day, 2 minutes at a time, flossing at nighttime before we brush so that we can get rid of all that plaque and that bacteria that grows around them so you don't get a new cavity or other issues that form around the veneer. The other thing you do want to do is just make sure you are being relatively careful with what you're chewing into. With veneers, they are strong, but they can still chip. So we want to make sure that we're not, biting really strongly into an apple, corn on the cob, like doing tearing motions, because that's going to be more likely that might chip. Taking it a little bit easier when you're chewing on those foods, chewing more in the back is going to help to extend the lifespan of those veneers. The last thing that is recommended for veneers, just like all of your other regular teeth, is coming in regularly for cleanings to allow us to remove that bacteria and that calculus, that hard plaque that builds up around the teeth, so that we don't have that bacteria just sitting there and again causing cavities or other issues. How long will my veneers last? So when we're looking at the composite veneers, generally we can get about anywhere from like 7 to 10 years out of them. Like I mentioned before, they are going to start picking up stains, and that's generally when they start to need to be replaced. When we're looking at the porcelain veneers, we generally can get a bit more out of that. So you're kind of looking usually about 10 to 15 years, maybe a little bit longer, depending on how you've been taking care of them in terms of avoiding really hard foods and things like that. What is the cost of veneers, and is there financing available? So when it comes to the cost, it really is dependent on each individual case because it depends on the number of teeth that we need to involve with doing the veneers. When you come in, that would be part of the initial diagnosis and talking to you about what results you're looking to get out of your veneers. And we would be happy to give you an individualized quote so that you're aware of the costs of the treatment. When it comes to financing, absolutely financing is available. And what a lot of patients will look to in order to get their treatment and be able to actually afford it. Again, this is a case-by-case basis, and we can certainly help you out with the application so that you can see if you're eligible for the financing. Will my insurance cover a portion of the treatment? So when it comes to veneers or any cosmetic treatment, insurance will not cover that. They will only cover treatments generally that have some disease associated with it. So like a filling, if there's a cavity, if you need a crown on a tooth that has a crack. So unfortunately, when it comes to veneers, because they are cosmetic, insurances generally don't cover that. So when should you schedule your appointment to get veneers? I would say if you're unhappy with the way that your teeth are looking, you want to just learn a little bit more about the veneers and see what options are available to you. I think that's a great time to reach out and we can discuss veneers with you. As with any cosmetic treatment, we do want to make sure that the rest of your mouth is healthy, and we would look at all the other teeth to make sure there's no other cavities or issues, but we would be happy at any point if you are interested to discuss that with you. Well, I hope I was able to answer some of your questions about veneers. If you do have any other questions or you are interested in discussing veneers for yourself, please feel free to reach out to us at 204-817-6768, and we'd be happy to help you.